So I'll give you an example of the impact of disability when we look particularly at injuries. And the reason for this is disability adjusted life years, as many of you probably know, takes into consideration disability of somebody before the age of 65. In other words, their most productive economic years. And it factors in the magnitude of something like, for example, a small infection that you get in your finger relative to an amputation as a result of a road traffic crash. So it's important to understand the impact that that disability has on a particular individual and a household. So along with Dr. Hailey DeBoss, Dr. Charlie Mock is known as kind of a grandfather in North America for work with regards to injury. And so Charlie Mock did a study in Ghana where there was a self-report of injuries over a 1-year survey. So they conducted a community-based survey, and actually one was just done in Cameroon, in multiple districts there, and the epidemiology from that is actually coming out. So you may see that in the coming months. So there was a household in-person survey, community-based survey, and it took into consideration about 11,000 people. What was found was that they were looking into injury resulting in greater than 1 day of disability. And so what they found was that many severely injured people, in other words, there were about 200 severely injured people, many did not seek formal care, but about 60% in fact did. But this is a significant amount out of those households, and you go back again to the households, and there were 11,000 people, and injury had a significant impact, and we'll go into that a little bit more. As you can see, in all the injured people, only 37% sought care at all at a hospital. And so as a result, the concern was that there was more disability because people did not seek formal medical care. 40% of the people who were severely, almost 40% who were severely injured did not seek formal medical care. Very concerning. So let's back up again and look at our disability adjusted life years, which is life years lost and life years spent in disability. And this is a way then that we can measure what the impact is on these households that go through such a significant burden of injury. So in other words, if you're looking at years of life with disability, if you're healthy, it's 0, and 1 is death. So something like an amputation would have a significant weight. We'll go through that a little bit more in a moment. If we only look at mortality, we see road traffic injuries in 2020. Here's the mortality impact that it would have. But if we look at it in terms of disability adjusted life years, it's actually up to number 3 by 2020 as far as the impact it would have. And it's very difficult for a country to grow socioeconomically if indeed we're only looking at mortality, because again, injury tends to take people at the prime of their lives. And so if you look at a road like this in Cameroon, you can imagine if you have a disability in some of the rural areas in Cameroon as a result of injury, it's very difficult to get around. So imagine somebody with an amputation, and I don't have to teach you this, trying to maneuver and navigate. And if that particular individual had been the breadwinner, it's really a significant challenge. We looked at the burden of disease in Nigeria, and again found, we're looking in terms of disability, and found that if we looked at people who were injured, they were unable to return to work at all at a frequency of about 13.5%. And they lost over 1 month of work 20% of the time. That has a significant impact. And here in the United States, the reverse is happening. We actually are at risk for economic reduction if we don't protect our most vulnerable populations from injury. In particular, as you know, I'm sure we have a very violent society. And if we don't start protecting our vulnerable populations from that violence, it's predicted by 2025 that our socioeconomics in this country will be greatly impacted. That's not that far away. So injury has a grave impact worldwide. So some of the coping strategies for injury in Ghana. So what happens to those families if somebody indeed is disabled as a result of injury? Well, what happens is there's a loss of family income and there's labor reallocation. So somebody else in the family needs to step up, and that's 90% of the time, to the point where now they're the breadwinners. The problem is they may have been taking care of the children instead. So what happens there? Family food consumption declines almost 30% of the time. And the production line, particularly in rural communities, is also reduced as a result. So that's what I mean when I talk about the overall impact of injury. It's quite significant. And then we looked into what happened from a significant earthquake that occurred in India in 2001. 18,000 people were killed and 136,000 people were injured. And there was a study that was done by Charlie Mock with his colleagues in India, looking at spinal cord injury. So those who had spinal cord injury, so did not die immediately from the earthquake, but 60% of those people were dead at 1 year because of the care that is rendered as a result of these, or the lack of care that's rendered as a result of these injuries. This is why we need to really impact trauma systems in low and middle income countries, to be able to really reduce this type of burden from injury itself. In Australia, relative to Cameroon, there was a survey done by some colleagues, and you may recognize perhaps some of those names, but it self-rated people. And what people wanted to find out was, how did paraplegia impact your life? And a vast majority of people in Cameroon felt that their lives were quite poor living with paraplegia, relative to Australia, where they actually felt that they had very good lives. And this all has to do with our capacity to care for people who have significant disabilities. So we think that, as a result of just looking at mortality, that's just the tip of the iceberg. And hopefully I've convinced you of that it's very important to look at disability.